therapist, physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Okay, the title of this is actually want you to watch this video before doing any back or sciatica exercises. We feel like you need to understand why you're doing exercises. You will get better compliance and you'll get better understanding of the specifics of an exercise.
Right, we're going to show you some nice models. You get a good visual, and when that happens, we find that patients really respond better. They comply better to the exercises. Everything rolls the right direction.
This video is part of a series of videos on sciatica. If you want to look at the complete series, go to bobandbrad.com and go to the program section. And you'll find it. There's a whole series. Just watch the ones you need to watch and forget the other ones. Brad, should we start off with number 1 here?
Complete is the word, Bob.
Yeah, it's a complete program. All right, the first reason why a lot of times we're going to have you do these exercises, we're trying to reshape the disc. Quite often the disc, if you look at the spine here, Brad's going to grab a pen or something like that. A screwdriver will work. So one of the problems with sciatica quite often is a disc may be pressing on a nerve.
Yeah. So this red part of the disc represents a bulging or herniated disc, and it's pressing into this spinal nerve, and that nerve actually goes down into the sciatic nerve and down into the leg, and that's why you get the leg pain and symptoms.
Exactly. So Brad's got these labeled L4 and L5. That's the disc or the levels of the vertebrae, and this is representing the disc. This is representing the 2 bones or the vertebrae, and a good healthy disc. It allows movement and there's no problems, there's no pressing out, but over time, if you repeatedly flex forward or stay flexed in a prolonged position, again, with time and depending on your anatomy, you can actually start to have the disc bulge out or herniate out.
This is a really nice model. This is actually going into the spinal cord. It's typically off to the side
a bit.
But the concept is the same. You got a physical force or mass pushing into that nerve. We need to release that, and we're going to do that through directional exercises.
Right. So one thing we're going to try to do, flexion forward causes this quite often. So we're actually going to have you bend the opposite direction and try to get that bulge or herniation to go back in.
Right.
So we're also going to do it just even by laying down and letting gravity do a little bit of it.
Right. There's also some options, attractions, and we'll cover all these very completely.
All right, the second reason why we might be having you do these exercises, like one thing, like for example, is flossing nerves. This is just like flossing your teeth. We're taking a piece of floss and we're trying to make the nerves move to the point where they actually can move without restriction. So we pull the nerve from one end while releasing it from another. And then we reverse it.
Do we want to give them a little show where the flossing occurs?
Sure, yeah.
I'll get in a little closer. We got some. So remember, we're going to look at the same nerve. I said this nerve actually ends up going all the way down to the leg, down to the ankle. And of course, it connects to the spinal cord, which eventually goes up to the head. And all that creates one like a piece of dental floss, if you will. And when you move your leg in a certain direction, the nerve actually pulls one direction, so it goes this way, and you move your head and neck in another direction, and we'll go through this in another video. So this nerve ends up going back and forth. There may be scar tissue in there. There could be a number of things causing that nerve to be pinched and bound up, and the flossing can free that up. And we'll give you exactly education exactly how to do that technique.
Yep, and it can help actually desensitize the nerve so it's not so sensitive to pain.
Right.
So number 3, we want to stretch body parts so as to allow you to get into proper positions when doing lifts or carrying stuff and such. A good example is that is like quite often when people, the normal person, when they bend over, they round out like this. Their back gets round.
Puts a lot of stress on that low back.
So you want to stretch your back enough that you can actually put an arch in there when you're bending.
Right.
And you can keep that arch. And that puts your back in a nice strengthened position. And that's the position we call that locked in position where the back is locked in.
Just good basic body mechanics that people aren't always aware of, and sometimes, like you said, they tighten up over the years, especially little older people, and they don't have that available. So we're going to show some specific stretches so that you can achieve that.
So get some movement, so you
Yep.
can easily obtain those movements, so that it's like putting your back in a cast. You know, your back is in a cast; it's not moving at all, so
Right.
it's nice and
Stabilize it.
stable, right?
Mhm.
And finally, we have two more yet. Number 4, we want to strengthen the muscles of the back and core,
Mhm.
obviously, but we also want to improve the endurance, because quite often, like especially if you have to stand for a while or lift for a while, or if you have to bend over for a while, you want to have the back to be able to hold that position for a long period of time.
Sure.
So.
Yep.
And number 5, we actually sometimes one of the exercises we recommend is a form of decompression or traction.
Right. Right.
So with that, basically, very in simple terms, we're just trying to stretch and pull the bones apart.
Right. Traction has been around for many, many decades. It's not as used as widely now because I guess because surgery's gotten a lot easier.
Right.
I don't know if that's if I can say that for sure, but we use it now. I've used it with patients. We don't. It's not our go-to thing, but it's certainly an option. You know,
Yeah.
inversion tables is a form of
Inversion
traction.
tables, and there's traction tables, and we got our hanging handles.
Right.
So
Yep.
and
Very
we'll-
simple.
Yeah, we'll have a whole video on that, but it can definitely give you some temporary relief.
Mhm.
And by giving you some temporary relief, then you can do stuff to make it more permanent.
Right.
So,
Right.
all right, that's the 5. Stick around and watch our next video that in the series.
Very good. Well
Thanks.
done, Bob.